Hi, I'm Dr. Christopher DuCoin, Professor of Surgery at the University of South Florida and Chief of GI and General Surgery. I'm an esophageal surgeon, and we wanted to make this video today to explain to you what a hiatal hernia or paraesophageal hernia is. We take care of a lot of patients with a hiatal hernia, so I thought it would be good to explain it to you. It's really when your stomach has herniated into your chest. It can create symptoms such as reflux or regurgitation, what we call GERD, gastroesophageal reflux disease, essentially when the stomach acid's coming up. If it's pushing on the esophagus, it can also create dysphagia or difficulty swallowing. Regardless, it doesn't belong in your chest. Your stomach belongs in your abdomen. Your thoracic cavity, your chest cavity, is really for your heart and your lungs. And our job is to get it back into the abdominal cavity. Now, we do this through small incisions, and we use some of the newest technology, which is robotic surgery, essentially the Da Vinci robot, which I'm sure you've heard about. The operation usually takes less than about an hour. On your hospital stay, you'll get a private room, and it's 2 days in the hospital or 1 night. After the operation, you'll get an upper GI to make sure the stomach is where it belongs. The operation itself consists of 3 major steps. 1, from the abdominal cavity through those small incisions using the robot, we're going to dissect that stomach out from around the heart and the lungs and get it back into the abdominal cavity. Next, we're going to close the defect or tighten up the diaphragm, so hopefully it doesn't come back. We're also going to do what's called an anti-reflux procedure. There's multiple options of what that could be, and we'll talk about that a little bit more in clinic. Once it's done, we fully expect you to come off of your antacid medicines. Almost a 98% success rate of not needing any anti-reflux medicine anymore. That's a classic PPI or proton pump inhibitor such as Prilosec or omeprazole. We're going to slowly progress your diet. So 4 days of liquids, but that's full liquids such as protein shakes or smoothies. And then we'll move to a soft diet until you come back and see us in clinic. That clinic appointment is usually 2 to 3 weeks after your surgical date. And at that appointment, we're going to wean you off or take you off those antacid meds. Now, while the surgery is very successful, and we do a lot of them, I do want to tell you there's always risks. Bleeding and infection, and hernias can always come back. We've got one of the lowest recurrence rates in the nation, though, and we're really proud of the work we do. We're one of the highest volume centers in the country, and because of that, we're also a training program. We train the next generation of surgeons. We have a dedicated fellowship program to this operation and other foregut or esophageal procedures. So, while you're in the hospital, you'll probably meet fellows and residents, surgeons in training, but I want to assure you that I do your operation in total and I make all the critical decisions. We're going to take great care of you, and I hope that explains a little bit more of what a paraesophageal or hiatal hernia is. I can't wait to meet you.